Welcome to the office. Welcome to the office.
Thank you.
What brings you here?
I am experiencing neck pain and also back pain, like between my shoulder blades.
Okay.
And yeah, that's pretty much.
So you came here for neck pain and back pain between your shoulder blades.
Yes.
Okay, but we need to go a little deeper in terms of the history. When did all this start?
It started 2 years ago. Yeah, it was 2 years. And I started with a headache. I was taking a migraine PM just so I could go to sleep because that was the only thing that I was taking.
So 2 years ago you started getting some headaches?
Yes.
You're taking some migraine medicine?
Migraine, yeah.
Okay.
I could take it 2 weeks further than that. We were actually at a party and I felt like this bowling ball hit the back of my head. And I started sweating. I went to the car. I started throwing up. And that's when we went to the ER the first time. But they said that I was having, migraine.
Okay.
And so they sent me back home with Motrin.
Okay.
So then 2 weeks from there, for those 2 weeks I was having a headache and everything. So then 2 weeks from that point, I had the seizure.
Okay.
From the seizure.
So what kind of seizure? Was it a grand mal, petite mal? Was it a big event? Was it short little tics? Like, can you describe the seizure, or can you describe the seizure? Like,
It was,
what does that mean to you? Because some people, don't know what a seizure is.
yeah, I mean, I never seen one, just that.
So what were you seeing?
She got stiffed.
Her whole body got
Yes,
stiff?
it was at 3 o'clock in the morning.
Okay, so you guys were sleeping?
Yeah, she woke up and
She woke up in pain, yelling,
she said,
screaming?
She woke up and she said, I need to throw up.
Okay.
And I was like, what? She's like, I need to throw up. And I'm like, okay, let me help you. So when I helped her go up, she went back and she was stiff as a board. I couldn't bend her or anything. Her legs were outside the bed, so she started sliding down towards the floor.
So she was in spastic contraction.
Yeah.
Everything was in spasm and contraction.
Exactly.
Got it, okay.
So
the
then,
whole body.
The whole body.
Got it, okay.
So then as she's falling, I grabbed her head so it won't hit the floor and I put her down.
Mm-hmm.
Then I ran and told her parents, something's happening. They came over and that's when, her sister called the ambulance and
Got
everything.
it, okay.
They did a CT scan. They saw that there was blood flowing already.
Okay.
And I got transferred to
So they
a
found
different
an
hospital.
aneurysm.
Yes,
Okay.
they did. So then I got transferred to a different hospital, and at least I was told that I had 3 strokes there,
Okay.
and I had the surgery and everything.
And what surgery did you have?
For a bursted aneurysm, and they did find another aneurysm, so they coiled it in.
Okay, so they put stents
Hmm.
inside. Okay.
Yes.
Did they mention what part of the brain it would be affecting? Do you remember them
No.
saying what part of the brain? Was it on the right side, the left side?
No, I just
Do you
remember.
any of that? Okay, we'll take a look at all that stuff later, but that's not really why you're here anyway, right?
Mm.
But it's good to get the history. So 2 years ago, you had the seizure, and you were diagnosed based on having headaches.
Mhm.
First they said migraines, 2 weeks you're dealing with it, did not resolve, had the episode, went into ER, they figured out on the CT it was an aneurysm, let's do the surgery, let's put in a stent to get things opened up. Okay. You get out of surgery, then what happens?
Getting out of surgery, then they were just monitoring to see if I was affected by
Okay.
it. They did induce me into a coma, and I was like that for 2 weeks.
Oh wow, okay, so you were coma induced for 2 weeks?
Yeah, for 2 weeks. So then they were just being careful as far as like me choking on my own saliva, if I was able to move. I wasn't able to walk because
How long did it take you to walk?
I was like less than a week on the wheelchair, and then I had the walker and then progressed to the cane, but perhaps less than 2 weeks. Was I less than 2 weeks? I was only getting like about an hour and a half or so of exercise because I would get tired.
Okay.
So we would just go to the elliptical and just try to do like light exercises and just walking in a straight line, trying to see if I could keep my balance,
Okay.
standing on one leg and then switching off to see if I guess if I was able to keep my balance. I'm not too sure.
And you were able to?
Yeah.
Okay,
Yeah.
and how long were you in rehab for?
12 days.
Excuse me.
Yeah, 2 weeks.
Okay. What other things are going on here? So you're here today because of this migraine from 2 years ago?
Yeah.
You still having those same symptoms?
No headache, no nothing. It's just literally my neck, and I feel like I need to crack it
All the time?
all the time.
You wake up stiff in the morning?
Yes.
Okay. You throughout the day it gets a little bit better, gets tight at the end of the day then?
Like around 2, I just feel so uncomfortable sitting down. Then
Okay.
I'm just squirming around trying to find comfort.
Are you working at a desk?
Yes.
Okay. So you're sitting most of the day working.
The whole
You're on
day,
a
yeah.
computer and a phone, I'm assuming?
hmm
Okay. Are there any other things going on, health-wise, that I need to know about? What other things are going on with you? Digestion, breathing, sleeping? Just so I have a background.
My breathing, I have asthma.
Okay.
I do take a controller for my
Now,
asthma.
the asthma, you've had it since when?
Birth.
Since birth?
Yes.
Okay. And typically, with asthma, one of the first questions I ask is, were you a C-section?
No.
Normal delivery?
Mhm.
Suction, forceps, any of that? Do you know?
I don't know.
Okay, it would be good to find out from mom, okay?
Okay.
Just good information to have. So you've had this asthma since birth. Is it a wet or a dry asthma?
At least before I got on the controller, it was wet.
Okay, so wet means you were producing a lot of mucus.
Yeah.
Okay,
It was just like popping up, and I was just constantly spitting.
got it,
So
okay.
that's
And
how
I
it
want to
was.
just mention the difference between wet and dry asthma. And you're not here for me to fix this, but I want to explain the physiology behind it and the mechanism neurologically, okay? So we have our trachea, right? We have this trachea, we have our windpipe. The windpipe goes into the lungs. The trachea has an opening in the back, and I'm using my hands for simplicity. So this is the breathing pipe, right? Right here. The back of it, it's like a horseshoe. There's a muscle on the back there called the trachealis muscle. Okay? It opens and closes the trachea. That is controlled by the sympathetic nervous system. The sympathetic nervous system, we'll explain in more detail later, is part of our fight or flight. It's the nerves in the middle of our spine. Okay? Now, we have all these glands around the inside of the trachea. They're called sebaceous glands, or not sebaceous glands, they're mucus glands. Okay? So, when we breathe, what happens? Those glands warm up the air, right? Give it a little bit of humidity so it's easy to diffuse into the lungs. If the muscle in the back is tight, the trachealis muscle should be, let's say, like this, doing its job. Let's say it's stuck and in spasm. What does it do to the opening of the trachea? Closes it, causes a breathing issue. That is a dry asthma, sympathetic issue. A wet asthma is when those glands inside are producing too much mucus, and the mucus constricts it. So it's not, the muscle is still there, but I'm showing her now. So the muscle hasn't contracted to close the trachea. The muscle is still doing its job there, but it's all these mucus glands that are producing too much mucus, and it's causing closure of the airway, causing a wet asthma. Now, that is a parasympathetic control. That usually comes from the upper cervical, okay, the neck. The dry asthma or the trachea, this is just what they have seen. This is what Gonstead had seen in his 55 years in practice. You know, he documented a lot of this. We're not fixing asthma. That's not what we're doing, but I'm just giving you the neurology based on Dr. Gonstead's work. And you'll let us know. Maybe something does happen, maybe it doesn't. We don't know. Okay?
Yeah.
But I want you to understand that. That's controlled up here. The trachealis muscle is controlled here. Okay? So I want you guys to know the difference. besides the asthma?
I'm also taking allergy pills.
Okay.
I have all year round allergies.
All year round allergies. What were you told about allergies?
That I'm allergic to dust.
Everything?
Cats. For sure cats. Any fur.
Okay.
Dogs.
All right.
And acne pills
Okay.
as well.
All right. So here's what's interesting. Allergies and acne. Okay. Again, let's talk a little bit about the physiology and the philosophy. So there is a physiological correlation between acne and allergies, and it goes through the adrenal system, the adrenal glands. Okay. Anytime we're looking, if you talk to anyone in Oriental medicine or alternative medicine, non-traditional medical, they'll tell you that, or holistic medicine, naturopathy, that most, if not all, skin conditions stem from the kidneys and or adrenals. The adrenals are part of your fight or flight, right? If you see a snake on the floor, your body reacts. If you think there's a snake there, your body reacts. That's what stress does to the body, okay? So adrenals help with fight or flight, they help with inflammation, they actually produce epinephrine for your eyes to control the dilation of the pupils. You have light sensitivities at all? You have to wear sunglasses a lot when you're outside?
I do, because for the acne medication.
Because it's affecting the adrenals.
Yeah.
Because what it's doing is this. When you're out, okay, so the iris or the pupil, it will constrict when there's a lot of light, just like a camera lens, right? Just like camera lens. This acne medication, so if you're having to wear sunglasses when you use that, because it's doing what? It's keeping the eyes dilated. It's keeping the eyes dilated to do whatever it's trying to do, and then you're out, it's not able to constrict in the sunlight, okay? We're going to test the pupillary light constriction. There's a test to test for. We're going to test that today as well. Allergies. What's an allergy? An allergy is your immune system doing something, trying to fight something off, right? Similar, same thing, adrenal system, immune and adrenals. So there's a correlation. You see, you're going to start to see things connect together now, okay? Obviously, I don't say anything about medication. I don't tell people to start or stop anything when it comes to medication. You'll just see what happens, okay? You're here for your neck. We're going to evaluate your whole spine. We're going to evaluate your extremities. And you're going to let us know kind of what else happens along the way.
Okay.
Anything else you need to tell me?
For my breathing, I
Yes.
also snore.
You snore.
Yes.
Allergies, asthma,
Yeah.
acne, neck pain,
Yes.
no headaches anymore.
No headaches. No.
How's your digestion? I'm going to ask you a funny question.
Good.
Does your poop, is it sink or swim? Is it dark or light? Does it float or does it sink?
Sink.
And is it dark or light?
I didn't.
Okay, just
Ooh.
notice that because it's important. It should
Okay.
be a darker brown, it should sink. It's a function of gallbladder. It's going to tell me other stuff about what's going on with you.
Okay.
Okay? As we're looking at it, let's look at a few things. So let's look at her shoulder blades. Right one's a little bit higher off to the side. As you're going down the spine here, you can see a little puffiness here, puffiness here. Then you can see the spine. It dips in there, but that's normal. That's okay. Here's what happens here. It comes out and it's just straight. There's no real curve in her low back. And just palpating, left side is higher, right side is lower. Okay? Now, as we run the fingers lightly, so good news is there's not a lot of lateral deviations in her spine. It's going to be more on that, looking at the curvature. Okay, and we'll talk about that in a second. Let's go ahead and run the instrument. We'll start at the base of the neck. Relax your shoulders, please. Good. You can come watch. We zero it out. The idea is when we get to a hot nerve, it's going to go to that side and come back. Now what's probably going to happen, it's going to switch to the left, and then the true pressure is going to come right there. Now, why did that happen? Obviously, there's a lot of muscular imbalances going on here. Those are all going to become apparent. So when they said you had a stroke or a pseudo stroke, they didn't say left-sided or right-sided?
No.
Okay. You don't remember?
I just know that they were doing like the ultrasound on this side.
On the right side?
Yeah.
So right side here?
Yeah, like they would put like all that gel like
On the
this
right side?
Yes.
Okay. Was your speech affected at all?
I don't think so.
Okay. Was
No.
there no?
No.
Okay, so we're getting a reading on the top left here. Do you see that? It's
Yeah.
it's consistent now, right there. Starting around the third cervical. That's around the fourth, or sorry, around the fifth, sixth thoracic. See how it's consistent? It's not a big one, but it's there. And then it stops.
Mm-hmm.
The adrenal area, kidneys, all here. And that's the thing that doesn't look right to me. I mean, you can see the color change even. See it, that patch?
Yeah.
It looks like a patch, like a brown patch.
Yeah.
It doesn't look right.
Christmas
Can you
tree
get
going
that,
on,
please?
right?
You see that,
Yeah,
right?
little Christmas tree
So
going on.
what does that mean? That means that the skin tone is different there. So as we're running it, I'm pretty sure we're going to get something here too. And it doesn't have to be a huge one because it could have been there for a while.
Wow.
Do you see that?
Mhm.
Now I would expect more going on in the low back here. Her low back spine is clear down here. We need to evaluate pelvis. So the readings we're getting here, here, and we're evaluate the pelvis. So let's statically palpate on this side. Head down. What we're looking for is tissue changes, texture changes, color changes, and pain. You can start to see right here. You can start to see as we're running it, right there. You see the shift? It changes right there, right
Mhm.
there. That's tender.
Oh, yes.
That's not. So as we get here, that doesn't feel so good.
No.
That feels okay?
Better than the other part, but
How
it's
about
still
here?
no. Oh, right there.
More here?
Yes.
Or more here?
Oh, the first right there.
That's where I feel it, and that was
Mhm.
the first mark, and that's where the break is. Okay? Head down, please. 1, 2, 3, 4. Number 5. 6. 5 more tender, 6 more tender.
I think 5.
5 is it. Okay, let's continue down. So I'm showing you it's a very distinct T5 major nerve supply, liver, gallbladder. Head down, which would also cause headaches and pseudo migraines and blood vascular issues. That doesn't feel so hot either, lady. More tender here. I feel it there.
Yeah, there. The second one.
Yep. Round your back, please. That's number 1. It's right there at 12. 1 is also tender. Yes?
Yes. Yep.
But 12 is the one.
Yes.
Okay. 12, 5. Let's check the neck. I don't actually think I'm going to even be starting in the neck today. Honestly. It's not coming from there.
Coming from the
5 and 12 is where I think we're going to start, but we're going to evaluate the pelvis because there's a lot of rotation in her pelvis. She's twisted. Good. Sit straight, scoot forward. Let's go ahead and check general motion SI joints, feet together, touching. Open and close your knees, please. Like a butterfly. Open wide, close. Open, close. Open, close. Right side only?
Mm-hmm.
Do the right side only.
Oh.
See the whole shift?
Mm-hmm.
Left side only. It shifts more when she's doing the right side. Okay? It's because the left side is what's stuck. Scoot back for me, please. Let's confirm it. Let me do the work.
Okay.
Do it, please. There you go. So, top of the joint, good. Middle of the joint, bueno. Bottom of the joint, good. Top of the joint, good. Middle of the joint, yeah. It's a little tender there too, right?
Yes.
So, middle and bottom's not really moving well. Left SI joint, T12, T5. What we need to analyze first is we're looking at the level foundation, making sure we have a level base and foundation. I'm going through this a little quicker in the drawings, and then I'll explain more in detail later. The other thing is we're going to be explaining even more on the second visit. And the reason why is, go back to, if we're in pain, right? Our body's in fight or flight, which we already know you're in fight or flight, the adrenal system. The first thing to shut off in fight or flight is what? Memory. So I wouldn't be surprised if you've been a little forgetful. We're doing T5, T12 left pelvis. Here's the thing with left pelvis. And this is why I know it was a trauma, okay? In your look. This started left low back. I'm talking about the spine. I'm not talking about the other stuff, okay? The pelvis moves like this. They move in opposite, this way. Your pelvis favors the right. Your L5 goes to the left. That's how I know it's a trauma. Now, if you are favoring right, if you stand on her right side, she's probably bumping you. You'll notice. If you don't notice it, you'll see. That's going to change also. No, stand on her right, walk together. She'll keep doing this to you. Test it. Even if I adjust it today, it'll be better. But
I'm gonna forget it. I'm gonna get it.
Okay. For the work, we have to do the EX major first. So we're going to do the pelvis. Once that's stable, then we need to do this for correcting. Okay? Different from feeling good. Why is this important? This is a 24-story building, right? 24 movable bones in the spine. Stuff in the neck, upper back, whatever is going on up here. But if we don't have a level foundation like a house, none of this is going to hold. Does that make sense?
Yeah.
So we're going to work on the foundation of the house. We're going to work on 12. We're going to work on 5. Then we're going to recheck with the spine. I'm pretty sure that's going to clear up. I know we're going to have to work on the neck, okay? But it's not starting from the neck. So that's what I need you guys to understand. You will also tell us the difference in your neck just from what I do here. It should change. Okay? Right there. Lift up. Up. There we go. And down. I got you the whole way now. Okay?
Okay.
You're okay?
Yes.
Are you comfortable?
Yes.
AS, EX. AS, EX, we want to bring it down and in.
I don't do anything right. I just
You
relax.
just chill. Smile at your future hubby. And say, hey, he gonna put me back together. He gonna put me all back together. There it is. Nice. Home run.
Wow.
Give that a second. Push yourself up. Swing your legs down. Start walking back and forth, please. Already different. What's different?
I at least before, I felt like I used to put more on this side.
And now? Keep walking. It's not a fluke. Let's go on the orange table. T5 PRS. 1, 2, 3, 4, 5. Chin up. There you go. And T12 PRIT. You okay there, dude?
Yeah.
Let's get a little bit more of this T5. There. Still a little bit. Drop the shoulders. There you go. PRIT. Let's do it this way. Home run. Now, as soon as it comes up, give it 3-4 seconds.
Uh-huh.
Let the body reset. 2, 3, 4. Go ahead and walk it off. Now you can tell us the difference. Straight line this
Oh
way.
my goodness.
You can breathe a little better too, right?
Yeah.
Oh, I'm sorry, I shouldn't have said that.
Oh my god, I could like
Yo,
clear.
Spence.
You could just feel like I could breathe from both nostrils. It's so cool.
We didn't touch your neck, did we?
No.
Nice. Have a seat.
Wow.
Pretty cool, huh?
Yeah.
As we're running the meter, post adjustment, neck is different. T5 is clear, T12 is clear. Low back is clear. Scoot back for me. Let me just remotion this left pelvis. You can tell us what's different. Look at that.
Oh, there's so much more movement too.
That's where we're going to start. You know your homework?
I hear, yes.
Okay, we're going to leave it at that for today.
80 ounces of water.
We're gonna regroup on Friday.
I'm
What?
so like shocked that I can breathe. Like it feels so much more clear. Like just being able to breathe. Like wow.
But
like
you didn't come here for breathing.
No,
What did
not
you
at
come here
all.
for?
For my back and neck pain.
How
I
does your
feel
neck,
so.
how does your neck feel?
Oh my god.
I didn't touch your neck.
It feels so. It feels. It's so cool. Thank you so much.
You're welcome.
I'm having less soreness. I have been doing my walking and
Okay.
swinging my arms. I
Okay.
was at the gym yesterday, you know.
Uh-huh.
And I did increase my water intake.
Excellent.
So yeah, I was more
Excellent.
conscious about it, so it's good.
Now, you know, in our first visit, there were a lot of stuff going on in your history, right?
Yes.
But in terms of why you came here was really for the neck pain
Yes.
and the back.
Yes.
So you were saying something about breathing.
Yes.
Have you had to use your inhaler since we started?
No. No.
Really?
Yes.
And you've been using your inhaler every day prior
Yeah.
to seeing prior to being adjusted?
Correct.
And how many times were you doing that? Once a
Every
day, twice a day?
It was about once a day.
Morning or night?
It was more in the afternoon that I would do it.
And did you find it was more exertional? Like when you were doing activity or just sitting, you know, just working?
No activity.
Activity related, okay. So I'm definitely getting pressure here at your third cervical today. And we know we're going to need to deal with the neck once this mid-back is starting to hold, which guess what?
Is it?
6 points. Not bad. I'm not getting T12 today. So remember, we were working on T5 and T12 to start. Remember? We were
Yes.
working on these two.
Yeah.
Today, I'm getting pressure at 6. 12 is clear. I'm getting pressure in the low back, and I'm getting the third cervical. So let's go ahead and palpate and see what's going on. So when we're statically palpating today, you can see a little tissue change there, but it's nowhere what it was that first day, and we have it for comparison. Watch. 7. 1, 2, 3, 4. That's the one we're working on. How does that feel compared to that first day?
Oh, it's much less.
I mean, it's still
But
a little
it's still-
tender.
yeah.
It's still a little tender. Much better at 12, right?
Yeah.
Yeah. Open and close the knees, please. Open wide and close. Open, close. Right side only. So you can see when she does that, the left goes with it. Right side only, please. There you go. You see the left goes with it. Keep going. Left side only. Right doesn't go. The pelvis has gone in AS, EX, so it's out like this. So just moving this side, it's going to naturally go with it because the EX is out. If it was an IN, it would present very differently. We're going to go ahead and set the AS-EX. We're going to set T5, and then I'm going to recheck the neck if we actually need to do it or not. Okay? What's really cool with you is that there's a lot of compensatory things that are taking care of themselves. And one of those compensatory things is your neck. Your neck wasn't really the issue, but it's been compensating for so long it became an issue. And, you know, it's one of the things in the work is really determining this, and that's why the full spine is so important. You know, when you go in with neck pain and you just go get a neck x-ray, oh, there's nothing there.
Yeah.
It's in your head. Take a painkiller, right?
I heard that before.
Is that, oh, did you hear that?
Yeah.
Is
Yeah,
that what
my
you were told?
boss. He was like, no, it's just me. He
It's-
thought that I was making it up.
And say, yes, it is in your head. It's your brain's interpretation of what's going on in your body. Left side down, please. Let's start on that pelvis, okay?
Okay.
We're going to do the ASEX pull move. Left pelvis. It's coming down and in. There it is. Gotcha. Home run. We're going to set T5 as a PRS. Chin up a little more. There you go. Home run. Nice deep breaths in. How's that? Well,
It is good.
what's that?
It's good. I mean, just being able to breathe. It's amazing.
Have a seat. And your test with the breathing is your cardio. Right?
Yeah.
And we're going to see how much cardio. I want you to get to an hour a day. Yeah, neck is still there. We're going to do the neck today.
Wow.
Yay! Now, the breathing you said had changed from just adjusting T5, right?
Mm-hmm.
So what's going to be interesting to see what happens here. Because up here, 3, 4, 5 of the cervicals control the diaphragm. There we go. There. Home run. Take a nice deep breath in. Take another nice deep breath in. Okay, go ahead and sit up straight. Stand on your right leg only, please. Left leg only, please. Okay. Hands on top of mine. On one leg, one leg. Look at me. Okay, this is low back. I'm going to have you close your eyes.
Mhm.
This is all upper cervical cerebellar function. Go ahead and close your eyes. This is testing your upper cervical. I'm right here. Open your eyes. Not a big change between eyes open and eyes closed there. It's a good thing.
Oh.
Other leg, please. So this is proprioception, this is low back, this is the glutes, nerves coming down to the lumbar spine. Close your eyes, all upper cervical. And I'm checking this to make sure after I adjusted your third cervical. And you're doing fantastic. Taking a nice deep breath, open your eyes. Open your eyes, taking a nice deep breath.
Thank you so much.
You're welcome. So we're on visit number 3,
Yes.
and let's take a look and see what's going on. So what happened since our last visit?
From the last visit, I haven't used my asthma pump. I used to take it on
So-
a daily,
You were using it, what, every day?
every day. Yes.
For how long? How many years?
Ooh, it's been years. I
Over
mean,
10?
just
10 years?
yeah.
Okay. Pretty much a long time, and then all of a sudden things opened up. But that's not what you're here for, and I'm not treating your asthma. Am I?
No, not at
No.
all.
And I'm not telling you to stop your inhaler, am I?
No, you're
No,
not.
not at all. It's just kind of cool that it just sits there on the shelf now,
Yeah,
right?
I have it there in the kitchen. I just see it now, but I mean,
So what else happened? What are the changes?
I did notice change in my voice.
What happened with the voice?
It cleared up. Like before,
Uh-huh.
I sounded like I was coming down with a cold, but after that, I mean, I didn't feel sick or anything, so that was the weird part about it. But from the last visit, even Isaiah was able to notice it when I called him up. He was like, "Oh, you sound better. You must be feeling better." And then, I mean, I felt the same with the voice.
But you didn't, but there was no, you didn't have like symptoms.
No,
You,
not
it was
at all.
just a voice change.
Correct.
Interesting.
Yeah.
So he said you sounded a little more clear.
Yeah.
Cool. Today, I'm still getting T5. We worked on C3 last visit. The neck actually showed up last visit. Yeah?
Yes, it did.
So we're going to evaluate. I'm getting a pressure reading today at C6, C7, T5, and L3. Okay, so things have shifted a lot. We started down here, 5, 4. That's where I'm getting it today at L3. Is that tender at all for you?
Slightly, yeah.
That's 4.
Okay.
That's 3.
4. 4.
Okay. L4, T5. Let's check the neck.
I don't have any pain in the neck. I'm not feeling anything. Just a slight pinching still between my shoulder blades.
Okay. And that was there when you came in, right?
Yeah, that was there.
Okay. So let's see if we can sort that out today for you. We're actually going to do C6 today, okay? And I don't think it's going to happen a lot, but I have a feeling that whatever shift has happened, C6 has showed up. So we're going to go ahead and set C6. Left hand up, please. There it is. Look up. Home run. Good. Okay. Let's go over here. 1, 2, 3, 4, 5. There you go, dear. Nice. That was a better sound for me. That was a nice hollow sound. That didn't hurt, did it?
No.
L3 to the knee, the ovary, and the testy and nails. Also affects the hip flexor. You're going to get a lot more power today in your walk, okay? Home run. Is it me or are you getting more pep in your step?
Yeah.
Breathe. Deep breathing, please.
I feel more even now when I walk. As far as feeling the pressures on my heel. Yeah.
Feels even.
Yeah. It feels even.
Go ahead and have a seat here, please. Let's rerun the meter. Take a nice deep breath in. Out. In through your nose. Out. In through your nose. Out. In through your nose. Out. I'm going to take your glasses off, please. Look up. We're going to do the nose today, okay? Your septum. I'm going to be adjusting your nose today.
Mine.
Yes, ma'am. There's a deviated septum here, and we're going to work on that. That's also going to help with your breathing. Let's look at the septum. It does this. It goes to her left and goes right. So the high side of the rainbow is right there, okay? On that left side. So we're going to take it this way and set it left to right. Go ahead and hold her, please. There we go. All the way over. There, gotcha. That's the worst of it. Deep breath in. Exhale through your mouth. In through your nose. Out through your mouth. Okay, go ahead and sit up. Let's do the jaw. Take a nice deep breath in. Different, right?
Yeah, it's more clear.
Yep. Slowly open. Open, 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 open. Slowly close. Yeah, this is a right jaw issue, left EX, but we're going to focus on this right jaw. Open, open. I got you, don't worry, okay? And as you close, I'm just going to guide it slowly. Let's do it again. Open, all the way, open. Slowly close. Good. Open all the way. Close halfway. Hold there. There. Open all the way. Close. Open fast. Close. Different. Talk to me. What happened?
The nose it feels much more clear than the first time. I mean, than the other adjustment. Yeah, I don't feel anything like blocking it or anything in there.
Enjoy it. It's been about a month.
It has, as far as my neck, that is fine. I just have a slight pinching on my back.
Okay.
But I think it's because I didn't stay consistent with the following
Okay, but how did you do the past month? I mean, life.
Good.
We have life stuff, right?
Yeah.
Life happens.
Yeah, everything's been good. Everything's been really good.
So back has been good?
Yeah, I just feel a slight pinching and I've been icing it, but it's
Okay.
not, I mean, something where it was like back in the day where it's like, okay, I have to, you know, stop my day short or
So
anything.
you've been working
Yeah.
consistently?
Yeah, even 10 hours now, so it's good. Yeah, it's really good.
As opposed to how long before?
Ooh, 3 hours, max 4, 5.
Okay.
So
So
yeah.
you're on a regular schedule now?
Yeah.
How about the breathing and the voice and the sinuses
The-
and the jaw and all that?
My nose, that one I still feel clear and everything, so that's good.
Okay.
As far as my jaw, I don't.
We need to work on it. We need to work on the jaw. But the breathing is better?
Yeah.
How long in this past month, how many times have you used your inhaler?
I think just twice because I was doing some moving. The
Okay.
apartment, we're just emptying out the apartment. So yeah, I was like, oh, I was,
Okay. So twice in the past month?
yes.
Not bad.
Yeah.
Not bad at all. Very cool. We're ready to get started?
Yeah.
All right, let's do it.
Okay.
And a little pressure at the base of the neck, not a lot, about 5 points. Getting a little bit at T5, T6 area. Now, we were working on your pelvis, remember?
Yes.
Yeah, we're working on that left pelvis. We're getting a little bit of pressure at the back. We've got about a 10-pointer on the low back. We'll do these 3, okay? And then we'll check and see how the pelvis is doing. And if we need to still do it, then we'll do it head down, please. So, static palpation. Completely different, the tissues. So it gets a little boggy, but that red orange peel that you used to have from day 1 is gone. Very nice. Right there. More tender there or there.
Right there.
Number 1, I feel it here.
2. Yeah, number 2, yeah.
Right. So as we were saying in the beginning, right? Relating to the breathing. We weren't here to fix the asthma, but as a side effect of the adjustment and being in balance, you didn't really have to use it, right? You
And
didn't
that
have-
is correct.
And it's been about a month since I've seen you for whatever reason, and you have to use it, and that's okay. No, that's totally okay. We are getting pressure at T6, we are getting pressure at C7, and we'll see if there's a difference in the breathing. Okay? You feel that right there?
Yes.
Right there. Let's check the pelvis now. Very cool. Nice. Okay. Actually, we don't have to do the pelvis. Okay?
Oh, great.
We're going to do L5, T6, and let's start with the neck, please. So, out of everything today in the exam, the low back and the mid back pressure readings were the least. So they were actually holding pretty well. It's the neck. And that's probably just work stuff. You're on the computer a lot?
Yes.
You actually have a lot more flexibility in your neck. So the lockout is a little different here. There it is. Look up. There you go. Good. Let's go on the orange table. There's T6. Home run. Number 5. There you go. Chin up a little bit, please. Let's relax the shoulders down. There it is. Good. A little more. Gotcha. All right, let's go ahead and walk that off twice, back and forth, please. Yeah, there's definitely a whole different walk. Definitely a whole different walk. Cool. Slowly open. Slowly close. Okay, slowly open. So the first thing that happens, it deviates this way, which means the right jaw slides out first. Go ahead, slowly open. And then the left compensates and brings it back out. So what we're going to do is we're going to set the left as an EXTMJ, and then we're going to set the right, kind of guide it like last time, okay?
Oh, gotcha.
So go ahead and open the jaw all the way and then close halfway.
Okay.
Open all the way. Close halfway. Hold it there. There you go. Now, I'm going to use a condyle block. The block is to just stabilize the neck here, please. All right, and go ahead and open the mouth all the way, all the way. Slowly start to close, and I'm just going to help guide that back in. Good. Let's do that one more time, please. Open, 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 open. Slowly start to close. There we go. Good. And I'm just going to use the machine on the TMJ. It's going to tickle a little bit. Feels like this. That's just to break up any scar tissue, okay? Open and close the jaw slowly, please. Open, close. Nice. Yeah, nice. Let's go on your back and check the nose, please. Just a tiny little bit left, but completely different from where we started. Just a tiny little bit right there. It deviates a little bit that way. But from where we started, the breathing is different.
Yes.
Okay. Pinch the nose, laterally flex, flex, flex. Gotcha. That's the worst of it. Okay. Go ahead and take in some deep breaths through your nose. Exhale. Breathe in. Breathe out. Come up slowly, please.
That always impresses me.
What's that?
The breathing part. That one just
That's
always
good.
gets me like, wow.
That's cool. Squeeze. Tiny bit on the elbow. And a tiny bit on the wrist. There you go. Squeeze. We're back on track. Let's talk about where we're at.
I've been doing the flossing
Okay.
for the neck.
Okay.
I just have a slight pinching. That went on like by my shoulder blade.
Okay.
That's the only thing.
How's the
besides
back?
that. The back is good.
How's the breathing?
The breathing is good.
Okay. So just a slight pinch on the right side.
Slight. Yeah.
Are you noticing a trigger that's causing it?
Um,
So like you left here last week, right? We saw you after a month. We saw you
Yeah.
3-4 visits in the beginning. Waited about a month. We saw you again. You were doing very well. Now it's a week.
yes.
In this week, so you left here, everything was good?
Yes.
Okay, and then when did you notice that pinching?
I don't.
Midweek, around midweek, or no?
Maybe.
Okay.
Maybe. I mean, it's not always there, but when I notice it, it's just there. Not that it hurts, but it's just
Same spot or
Mhm.
different?
same spot.
Okay. Let's point to it, please.
Okay.
Can you point to it?
Probably somewhere.
Is it more on the side of the spine or is it more on the spine
No,
itself?
I think it's on the side.
Okay.
Oh, I didn't even.
So like in this area here or more in here?
I mean, right, like
So when
near
I
the
go
second.
when I go down the spine,
Right there.
yeah,
Right there.
that's a rib head. Okay?
Okay.
So we're going to check spine first, and we're
Uh-huh.
going to go ahead and check the rib. Can I ask you how many times you used your inhaler this week?
0.
Seriously?
Yeah, I haven't used it.
Wow.
I mean, I carry it, but I haven't used it.
Cool. So everything else is looking good.
Yes.
All right, so today I'm getting up top here around the second cervical. We're getting, base of the neck is clear. Now here's what's interesting. Watch the meter here, please. It goes to the right like it's a reading, but it doesn't stop at 0. It keeps going, and then it breaks there. So it's actually down here, the nerve pressure today. This is going to be a rib head we're going to assess, but we did work on that before in terms of the vertebrae. The vertebrae is actually holding. So the good news, because the vertebrae is holding, we can set the rib back into the demifacet without it, or sorry, we can set the rib back into that demifacet knowing it'll hold better because the vertebrae is stable.
It's okay.
Does that make sense?
A little.
So let me explain this. We have the bone, right? And we have the rib that attaches. And if you want me to show you, I can actually show you better here. T1 through T12. And we have these ribs that attach into the vertebrae, okay? So the rib bone actually attaches to the vertebrae itself.
Okay.
Does that make sense?
Yeah.
And with that, when the vertebrae shifts out of alignment, let me grab a model. Now, I want you to see these spaces in here. See these little dips? Those are called demifacets. And the ribs attach there, like that. Okay? They attach to the bone, the vertebrae, the spine. So if the spine is out, watch my fingers here. If the spine is out, the vertebrae is out, what does it do to the rib? Okay? Now, long standing, it does this. So there's a capsule that goes around that joint there, okay? When it misaligns like that, either this way or the rib pops a little bit this way, we run our fingers down the paraspinals and you feel that little bump. That's what we were feeling. We had already addressed that vertebrae in previous visits. The vertebrae is holding, it's just now the rib head we need to set back in. Doesn't hurt any more or less, okay? But I just wanted to show you that it's, the rib is affected also by the bone. And if the bone is out and the rib is out, then we're not doing the rib, we're gonna do the vertebrae first. But your vertebrae had no nerve pressure.
Okay,
So that's the good news. Family notices the difference,
Yes. I'm not complaining anymore.
and you're working your full 10 hours, right?
I am, yeah.
Awesome. That's amazing. Okay, fifth lumbar. Let's do static palpation. Head down, please. What's really cool here is we're doing this. The tissue texture changes are completely different. That swelling is pretty much gone. There's a tiny little bit, not much. It's shifted down here. You can see right there. Right there. Head down, please. Thank you. Round your back slowly. Right. More tender at the, yep, that's the one.
yeah.
That one's tender, but not as bad as that one.
Correct.
Okay, let's make a count. 1, 2, 3, 4, 5, 6, 7, 8. How's 9?
8.
Eight.
Yeah.
Let's do
Hurts
another
more.
count just to make sure. 7, 1, 2, 3, 4, 5, 6, 7. That's T8. When she's doing the right side, that left wants to go with it. Do the left side. Same thing with the left, but it feels like this side is stuck more here. Do you feel that?
Uh-huh.
Yeah?
Yeah.
Scoot back for me, please. Let's motion it now. Okay, let's do this is the right SI joint. Hands on your lap, please. Thank you. Top of the joint, middle of the joint, bottom of the joint. That's moving well. No pain with any of that, right?
Just where you're putting the pressure?
On the right side?
Yeah.
Okay. Finger pressure?
Yeah.
Nothing sharp.
No.
Okay. Top of the joint, middle of the joint, bottom of the joint. It's a little tight, but it's actually moving decent. We're gonna set fifth lumbar. We're gonna do T8, fifth lumbar. Let's check the neck. 6, 5, 4, 3. Head down, please. Head down. There we go. Tender when I push on that left side. Not as bad on the right. And when I bend, laterally flex that C2 on the right, it's fine. When I do it on the left, it's catching right there. Okay. C2, T8, and fifth lumbar. Let me just go ahead and look at your films. PRI, C2. Left hand up, please. C2. Home run. Nice. Let's go over on the orange table. T8 we need to set as a PRS, and L5 we need to set as a PRS as well. 2, 3, 4, 5, 6, 7, 8. There it is. Lady, that's tight. Gotcha. Have to go a little bit deeper on that one. You okay there?
Yeah.
L5. Now for this L5 PRS, I'm just crossing over, torquing clockwise that way, okay?
Okay.
Gotcha. All right. Awesome. Let's walk it off. Up on your toes. Back over here, have a seat. Let's rescope you. Are you still feeling this rib catching?
No. Very little.
A little bit, right?
Yeah, just a little. I can feel it there, but it's very little.
Okay, so let's make sure spine is clear, and then we're going to go back and do the rib head, okay? There you go. Nice. All clear there, young lady. Let's go back on the orange table and do the rib head. First, just going along the paraspinals. Right there. Now, 1, 2, 3, 4. It's the 5th rib head on the right. And we're getting the tissue out of the way, getting right on that rib head, arching the knuckles, deep breath in, blow it out fast. Good. Got it. That's it. There you go. Awesome. Deep breath in, blow it out the same nostril. Deep breath in, blow it out, go a little deeper, and out. Nice. Deeper, and out. I'm not going to mess with that one today. We're going to work on the jaw. Slowly open the jaw, slowly close. Tiny little bit, open, close. Definitely much smoother than it was.
Yeah, that for the jaw I did notice it because it used to do a slight jerk,
Okay?
but now it's just.
There's a little deviation, but there's no clicking and popping. Okay? Now, we're going to be setting right AI, which means anterior, inferior on the right side. And what we're doing is we're just guiding it back in place. Go ahead and open your mouth all the way, all the way. Slowly start to close. Good. Let's do that again. Open. Slowly close. Just guide it, going more before bringing it over. Okay? Good. Go ahead and open. Close. Open all the way. Close. There you go. Open. Close. Open. Close. Let's just do a little machine on it. That's just working the pterygoids, the masseter muscles, loosening it up a bit. Good. And let's do the ear. There you go. There you go. Stand up for me, please. Good. Squeeze. 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 Tiny little bit in the elbow, posterior radial head. There you go. Squeeze. Solid. You're all set, lady.
Thank you so
got it,
much.
dear. Have a good day, okay?